So our next candidate is running for position 5, Bay Area Health District, and it is Cody Borgogno, and he will introduce himself to you.
Thank you. My name is Cody Borgogno. I'm running for the Bay Area Health District 5 position. I'd like to take this opportunity to tell you a little bit about my background and why I'm running. Coos County is a special place in my heart. I've grown up here and lived here, worked here even, a majority of my life. I've attended Coos-based schools where I played football, wrestling, and ran track for Marshfield, as well as served as elected student body president my senior year. I truly feel fortunate to have come from such an amazing community. I left in my early 20s to pursue my trade school degree and another time to start my career as a millwright. But there's nothing like home. So my wife and I have settled down in Coos Bay. We raise our 3 boys and now work as union electrician apprentices, which I'll get to be a journeyman here, hopefully by summertime, if everything goes right. And the active members of the IBW. When I was young, my mom started working at Bay Area Hospital, continued working there throughout my adulthood. Along the way, I've made a lot of memories at the hospital, everything from doing homework in an empty office while my mom worked, to countless times I met her for lunch in the cafeteria. And the lasting friendships I've made with some of the employees I've encountered there throughout the time. Bay Area Hospital is where my wife delivered 2 of our sons, and where most our friends and family have delivered their children. It's where even now, one of our close friends is taking his mother for chemotherapy, for cancer treatment, sorry. It's an important pillar to our community, and our community needs to be represented there. I'm running for this position on the board of directors because I believe strongly in the people having a voice at the table. As a middle-class working person, I understand what it's like to feel like those meant to serve us don't prioritize the interests of the people they're elected to represent, or even hear our voices. I know there are many of you like me that work every day building this country and working to provide its services, but never quite feeling like we have much of a say in its politics or way it's ran. It's time for people like us to step up and run for these positions, to make certain that the voice of the people is never lost and never forgotten. As a board member, I will ensure that the workers that make the hospital run are valued and respected, and that the community members come first. A publicly owned entity should include the needs of the public in its decision every step of the way. And I will work hard to ensure that that happens with clear communication, transparency. With your support, I'll be able to step up and be a bridge between the hospital and the community it serves. Once again, I'm Cody Borgogno, and I hope to earn your vote for Bay Area Health District Position 5.
And the first question is a little duplicative of your opening statement, but again, the question is, why are you running for a seat on the hospital board? Describe your qualifications and experience.
Okay, thank you. I'm running for a seat on the hospital board because I want to make sure that the people's voices are heard. I want the employees that run the hospital, that work at the hospital, I want to make sure that the community's voices are heard, and I'm going to do everything I can to make that happen. I plan on talking to people, going out in the community, doing everything I can just to basically give everybody a voice, give them a reason to, I can't say want to go to the hospital because everybody knows that when you go to the hospital, it's never usually a good thing, but I want to make it a better experience, basically, is what I'm trying to say. I was a ASB president in high school. My senior year, I had a blast doing it. It was ASB, Associated Student Body President. I had a blast doing it. I want to, that's kind of about where my experience is. Unfortunately, I'm pretty new at this, but you got to start somewhere. And I feel like I can do this. I feel like this is something that I really am passionate about and will do my very best.
Recruiting and retaining physicians and other health professionals can be a challenge for this area. What is the role of the health district in helping to assure that there are sufficient practitioners to meet the needs of the community?
I'm doing a lot of research into this. I'm learning about this position more and more every day, and but to be honest, I'm not 100% sure at the moment.
Describe your experience in reviewing budgets and understanding the financial resources and expenses necessary to manage a large health organization.
So I do have some experience with that. I am a member of the IBEW. We have our union meetings, since the COVID things happened, we haven't been able to do many meetings. But when we did have them, we would have our budgets and we'd go through and be able to review them and everything like that. And I have started to grow quite, I guess you could add accustomed. Not accustomed. Sorry. I'm learning. I've learned more and more about it, and as I'm going, I am getting better and better with it.
In accordance with the hospital's mission to improve the health of our community every day, what is your vision of how the hospital can serve the community in addition to providing medical services?
With that, I think that we can reach out to the community a little bit more, kind of see what people feel like needs to be, if there's any problems that the community has with the hospital, what can be adjusted, can be changed, can be fixed, can be tweaked. I feel like doing that with the community, with the workers, we can reach out to them and talk to them, make it, maybe there's something that can be made more of an enjoyable, make it a more, not environment, a more enjoyable experience for them. That way you get happier workers, you get better people, you get better experiences there. It is kind of a place where people unfortunately are sick, they're injured and stuff like that, but it doesn't always have to be bad. Well, it doesn't have to be a bad visit, basically. There's ways that it can be improved. Kind of a off topic, an example, when my mom was working there, she was working in 2D, and she started bringing stuffed animals to patients, to little kids and stuff, just because it made it better. And little things like that can make a big difference, I feel like.
And here's the last question.
Okay.
What would be the role of the hospital board in assuring that issues of diversity, equity, and inclusion are addressed, not only within the hospital's personnel, but also in the provision of services?
I want to make sure everybody's voice is heard. I want to make sure, I feel like you shouldn't have to fight to hear it. We should be able to be everybody's voice.
All right, now is your turn to, your chance to do a final explanation for why you're running and why you would think the voters should elect you.
I'm running for board of directors. I want to make sure, health district board of directors, I want to make sure everybody's voice is heard. Employees, the people that serve the hospital, the community. I'm going to do everything I can to make it a better place, to make it enjoyable. I hope you vote for me. My name is Cody Borgogno, and I'm running for board of directors, district board. Oh my gosh, hospital board of directors, position 5.